I was grinding my teeth and I ruined my teeth. I became the chief medical officer of my company and the president of the medical group, and I did a lot of speaking in front of people. And quite frankly, I was embarrassed because you couldn't see my teeth. You know, I've ground my teeth down to almost nothing.
I noticed I started having some popping in my joint, my TMJ joint. I would get headaches. My jaws would get tired after eating. Just my face would get tired even. I would have neck problems and sometimes hard to get comfortable in bed at night. And this went on for years, and I thought it was just something I had to live with.
Before I met Dr. Duncan, I suffered from chronic migraines. There were times where it would affect me so severely that it would impact my ability to do my job. And meeting with Dr. Duncan and developing a plan.
Well, for years I had jaw and neck pain, and it really affected my life. I wasn't as active. I was very depressed, very not interested in doing things. I was so much in pain that I had seen 20 different doctors, from medical doctors to dentists.
Dr. Duncan introduced me to a new approach to try to alleviate the symptoms, and it started with a orthotic that was custom fitted for me, that was semi-permanent in nature.
As soon as I stepped here, I was welcomed and saw Dr. Holley. She did the evaluation and she said, "I think you have TMD." She explained the whole process and how, you know, she took me serious, and I felt like I had hope.
So I started researching other dentists in the area, and I thought, well, Mandy Holley, I've heard great things about her, so I'm going to go to her. And when I did, she just started immediately addressing my TMJ. When I opened my mouth, I had the popping and the clicking, and she addressed those for me, gave me a plan of what to do.
We didn't just create the orthotic out of thin air. It was through a lot of testing and analysis of my bite and what was wrong with my bite, and crafted specifically to realign my jaw to a position that was natural and comfortable.
Dr. Holley talked to me and she said that I needed to wear an orthotic for 6 months. And during that time, I had to come in and they would make adjustments and test me again. And that went very well.
I had doubts about doing this. I really had big doubts. But I would do it again and again and again if I had to. The pain was nothing. The time wasn't as bad as it was going to be. And the results are unlike any other results.
By reprogramming your musculature in your face, getting your jaw to a comfortable position, and then putting your teeth in the right place to support that position, that's the better way to do it than just breaking your jaw.
I feel great. I feel so much better. I don't have the pain that I had, in my jaw and down my neck. I can function. I have my life back.
She's gone beyond, I think, what most dentists do to educate herself in different problems. She stays up to date, and thank goodness she does, because that's how I found her, and she was able to help me and actually give me my life back.